Hi, Dr. Christina. How are you?
Hi, Dr. Danielle. I'm good. How are you?
Good, thanks. First of all, I just want to say welcome and just introduce the topic. So today, Dr. Christina here is going to be talking about hormonal versus non-hormonal therapies for menopause. And this is being offered by Health Buddha. So thank you so much for being here. My name is Danielle O'Connor. I'm also a naturopathic doctor that practices in the Burlington and Oakville area. And I am so pleased to be here speaking with Dr. Christina today. And we're going to be talking all about menopause. So just, if anybody has any questions, feel free to put them in the chat. And hopefully at the end of the session, we'll be able to get to some of those questions. But I'm excited to get started. So Dr. Christina, I'll let you take it away and introduce yourself, and we'll get going from there.
Perfect. Well, first of all, thank you for having me here today. I really enjoy talking about menopause. I'm sure you as well. You probably have a lot of patients that are coming to see you for perimenopause, menopause. So it becomes one of our mainstreams in practice. So yes, welcome everyone. Thank you for joining. My name is Dr. Christina Christoforou, and I am a naturopathic doctor in the Oakville area now. I was in Mississauga, but now we're in the Oakville for the past 2.5 years.
Wonderful. Okay, so we both see patients that are in perimenopause and menopause, and I know that this can be a really confusing time for women, right? Like there's changes that are happening to their bodies, with their moods, with everything, and sometimes it can be really difficult to really know what's going on. So I just want to start off by asking you if you can kind of define like what is menopause and what are those associated signs and symptoms that a lot of women experience.
Yeah, that's a great question, Dr. Danielle. So women can be in perimenopause for a while before they actually hit menopause. So it's confusing time for women to know, well, where am I? Am I in perimenopause or am I in menopause? So the way we define menopause is actually not having a period, and it's ideally for 12 consecutive months. If you're having a period and no period for, then you have a period or no period and it jumps around a lot, then you're still considered perimenopause. But 12 months without a period is where we say, okay, now you're officially in menopause. So the signs and symptoms, again, you can be experiencing these symptoms in perimenopause. So perimenopause and menopause, I feel they do tend to overlap. But the main symptoms that you see is definitely the hot flashes, the night sweats. One of the other big ones is insomnia or irritability. I find weight gain is another big one, depression. You might even get like migraine headaches associated with it. Sometimes women also have urinary incontinence. Not all women, but that can be one of the signs or symptoms. And yeah, that's pretty much the main ones, I would say.
Yeah, absolutely. And I know those are a lot of the ones that people often complain about. And I love that you added in like the urinary incontinence. Like these are things that a lot of women experience, that feeling that they also may have like a yeast infection, but then they go and get checked and it's like you don't actually have one, right? And it's part of those changing hormones. And so it's really interesting that women do experience these symptoms that they don't necessarily realize, like, this is actually associated with changing hormones, right?
Absolutely. And women sometimes think that there's something wrong with them, or they think they're going crazy. Like, why am I feeling this way? And it is part of the hormonal changes. It's part of that natural transition. But of course, we want to minimize those symptoms as much as possible.
Right, absolutely. Okay, and so in terms of like your approach to helping women that are going through, whether it be perimenopause or menopause, what is your naturopathic approach?
Yeah, that's a great question. So first things first, I think a lot of women find it very confusing as to where am I? So I do find testing is a good way to start. If they're still getting a period but missing months, we kind of don't know where their hormones are at. So I give my patients a choice. Blood work, they can definitely do that. They can always do it through me or through their doctor. But the main ones I like to test is the estradiol. That's your reproductive estrogen, and that is the one that declines when you're in menopause. So it's always good to know where it's at. I also like to test progesterone as well. The best time to test progesterone usually is the week before your period if you have a period. But if you can't measure that, then we kind of test, okay, well, you haven't had a period in 3 months. Let's just see where you're at. And then I may add some other things like their cortisol levels or their DHEA. And depending on other complaints they have, if let's say weight gain is one of them, I may also throw in a thyroid panel. But the main ones would be the estradiol, the progesterone, and then the other big one is also FSH, because that's the one that tends to double or triple in menopause. So that's the one that guarantees you are in menopause. If we're not sure where you're at, I also like to do the Dutch test. I'm sure you use that one as well. The Dutch hormone complete test, which is using urine, dried urine, which tends to be a little easier for patients versus doing a blood drop. That's another one that I do. And then if we see, so going back to the blood work, if we see that the estradiol is like less than 40, then we know, okay, you're in menopause. And if the progesterone is usually in the low numbers, like 2 or 3, or even less than that, less than 1, that means, yes, you are in menopause, because we can't even measure those numbers anymore.
Absolutely. And I'm sure there's quite a range too, right? In terms of those hormones, right? So sometimes women can be like completely in menopause, and sometimes they're bordering, right? Depending, maybe perimenopause, that type of
That's
thing,
the
right?
thing.
So it's good to get that assessment done. Absolutely. Perfect. And then is there usually like lifestyle recommendations? Are there, like what
Yes,
do you
yes.
like to do?
Yes. So I always like to kind of start simple. Again, it depends on the severity of the symptoms. So if like hot flashes and night sweats are really debilitating and it's affecting their day-to-day life, then I would be like, okay, we need to start some sort of supplementation where diet and lifestyle changes may not be enough. But if it's like they're feeling it, but it's not too bad, then I always jump on the diet, but then we say, okay, let's just focus on the diet first. So I do find like a Mediterranean-based diet it tends to be really, really helpful. The other thing is focusing on phytoestrogenic foods. So basically, again, with the changes in the estrogens, phytoestrogenic foods are foods like flaxseed or chickpeas, for instance, or lentils or beans. And what they do is they bind to the receptor where the estrogen is supposed to go. So that way you kind of provide that balance and you're not getting that crazy up and down dip with your estrogens. And then it helps minimize or even get rid of a lot of the symptoms. So I do like focusing on phytoestrogenic foods, like I said, Mediterranean-based diet, and then a lot of even brassica family foods. So things like the broccoli or cauliflower or Brussels sprouts. They tend to have something called I3C or indole 3 carbinol, which ensures that your body's not making those bad estrogens, because that's something that can also happen, which we don't want. So we want your body to be working really well to eliminate that. With respect to lifestyle changes, I do find women that are more stressed, anxious, anxiety tend to have way more symptoms. So I do find focusing on stress reduction can really be helpful. So if they're a really busy mom or they're a teacher or they have so many kids, whatever it may be, they're highly stressed. So I'd like to focus on, okay, what can we do to minimize that stress? We look at sleep patterns. How are you sleeping? Or do you have your phone next to you? Are you watching TV before bed? We don't want to be doing those type of things. You want to start like a nice bedtime routine, which is usually what I like to tell my patients. And then incorporating things like mindfulness, whether it's meditation or yoga, I do find those type of things also can really, really help. And then when stress levels are down, then the symptoms are much reduced as well. And then when it comes to like going to bed at night, I might say, okay, like, make sure you have light bed sheets, maybe dropping the temperature down a little bit at night, wearing looser clothes. So I find that's huge, and avoiding things like alcohol or coffee or even spicy food, because those foods can actually exacerbate symptoms as well.
Great. Yeah, those are great tips, and I think even making some of those changes with your diet and lifestyle can make a huge impact, right? So I think that's fantastic. Now, in terms of, supplementation and
Yes.
herbals that can help with some of the symptoms. And we'll also go into like the bioidenticals, like the
Yes.
other options that are, but maybe if you can just give some insight on some, favorite supplements or herbals or different things that you find really effective for your patients.
Yes, I do find one of the or two top ones that I find that work really well. One of the big ones is chasteberry, also known as Vitax. We call this the hormone balancer. And typically, again, with menopause, not only estrogen goes down, but the progesterone goes down as well. Where the Vitax or the chasteberry, what it does is helps balance out those hormones. So that way, a lot of your signs and symptoms are much reduced. So that's one of them. Another one I like to do is the black cohosh. I do find it does help with the night sweats. I actually have like a really great product that I like to use. It has a combination of the chasteberry. It does have the black cohosh in it. And then I would like to add some sort of adrenal support too. So, I mean, there's so many different combinations, but if you can find one that, let's say, has the black cohosh or maybe some sort of isoflavones, the chasteberry or Vitex, and then some sort of adrenal support, like maybe an ashwagandha or maybe the L-theanine, I find that combination really does help well because again, women midlife, a lot of them are highly stressed. And I do find you need to take care of balancing perhaps that excess cortisol. And when you do that, a lot of the signs and symptoms are reduced. So yes, the hot flashes, the night sweats, the insomnia, because you're more balanced when it comes to your stress. So those I would say would be like my top three that I do love to use.
Awesome. Yeah. And I totally agree with you. I'm the same. Like I use the same ones with a lot of my patients and they do really well with them. And I think that, a lot of women like the hot flashes, the night sweats, it really does affect your overall health and wellness. Right. And
Yes.
so you're
Yes.
not necessarily able to, function the way you're used to functioning day in and day out. And so to be able to use some of those herbals and supplements to help reduce that is amazing, and to
Yeah,
help support your hormones at the same time, right,
exactly.
is fantastic. So I love that. But I know even from my patients, sometimes it's not quite enough, right? Like
True.
sometimes we use the herbals and there's definitely benefits, but sometimes you need to kind of take it to the next step. So there is bioidentical hormones. And then there's also synthetic hormones, right? Which is some people are able to get through their medical doctors. So, really, maybe we can just start out with, what are the differences?
Yeah.
When would you use bioidentical hormones for your patients? What forms? You can just tell us all about them.
Yes, and it's definitely amazing that we can now, as naturopaths, prescribe bioidentical hormones because back in the day, it wasn't something that we could do. So when we were able to get those prescribing rights, we were like, yes, now we can help our patients even more. So yes, there's definitely been a lot of like controversy around the synthetic hormones. I'm sure you were very aware of that big study that came out in 2002, where they used the synthetic hormones using whether it was the Premarin or the Provera. And basically, the point of the study was to see if women had benefit when it came to protecting their heart, protecting against other ailments. And they actually had to stop the study short because a lot of women were getting side effects. And the types of side effects they found was actually a lot of heart related stuff. So I think blood clots was like 200% increase in blood clots. Stroke was like 40%. Breast cancer risk was up to 26%. So they actually had to stop the study. And this was like the number one thing to use when it came to hormone replacement therapy. So even medical doctors were kind of like, okay, we know we cannot do this for our patients anymore, right? So what would be another alternative? Now, mind you, bioidentical hormones have been around since like the 1930s, actually, believe it or not. I didn't even know that. That's something that I was reading, but like, oh, okay. But since that study in 2002, it's definitely pushed even medical doctors to use more of the bioidentical hormones. So what are bioidentical hormones? So basically, it is plant-based, and it's something that is very identical to our bodies. So what that means is that if something is working the same way the way your body works, so just think of it as a lock and key approach, right? So the synthetic hormones is made in a lab, right? And they're trying to mimic the hormones, but it's never exactly the same. So I find it doesn't work as well either. I mean, it can, but not as well if something is more identical to your body. So that's where the bioidentical hormones come in. I do find with synthetic hormones, usually it is more orally based. So basically it's, they usually give like a pill form. I don't even know if they do like transdermal. I think that's more bioidentical, but from what I know, or they can do a suppository. But with bioidentical, this is what I love. So synthetic hormones, you get a dose that's on the pill, and that's it. With bioidentical, we can decide the dose for the patient, which is kind of nice. In bioidentical hormones, it can be transdermal. Yes, it could be a pill. As naturopathic doctors, we do like using the creams, which is the transdermal, or it can be suppository as well. So either or. But I do find the bioidentical creams are the best way to go. So when a patient comes in and we're looking at the numbers of what's happening with their hormones, we can decide dose-wise what to give them. So how much estrogen, how much progesterone. The other thing I like about bioidentical hormones is the ones that we use as naturopathic doctors is using a combination of two hormones. It's biased is the form that we use, and it's usually a combination of the estradiol and the weaker estrogen, estriol. Studies have shown actually with the estriol form, risk of breast cancer is like next to nil. So I like the fact as naturopathic doctors that yes, we can throw in the estradiol, but we also put in the estriol. So any risk that can be associated with it is completely eliminated or diminished. Now, a lot of my patients also ask, well, what about breast cancer with bioidentical hormones? The studies aren't there to show that it will cause breast cancer, but the benefit of bioidentical hormones is not giving estrogen by itself, which as naturopathic doctors, we don't do anyway. So I find if we are dealing with any risk with the estradiol, one, you're not getting a lot because you're combining it with estriol, which is a weaker estrogen, and you're always combining it with the progesterone. Well, bioidentical progesterone is actually protective against breast cancer. It actually inhibits breast cell division. So again, if you're like, well, I'm worried about estrogen, well, if you're always combining the two together, then any risk that may happen, you're not getting it. And I think that's probably why there's no studies out there saying, oh yes, bioidentical hormones cause cancer, because it doesn't. The other thing as well, it actually is very protective when it comes to your heart health. It actually prevents clots, obviously preventing osteoporosis. So the benefits are multitude, which is amazing. So that's something that I like to use a lot is the combination of progesterone and the biased in a cream form. And then if women are experiencing vaginal dryness, for instance, one of the best things I like to use is the estriol vaginal cream. So again, estriol, which is the weaker estrogen. And then a lot of times I like to combine like a little bit of aloe or hyaluronic acid or vitamin E. And I find it, I don't think I've had one patient come back to me saying it didn't work. I find that estriol cream, which you apply vaginally, works amazing for the vaginal dryness. So a lot of times I make the cream in combination with creams, which I find is absolutely amazing. So yes, bioidentical hormones I find is the way to go. And yeah, synthetic hormones, I don't even think a lot of medical doctors even prescribe it to their patients anymore. They completely withdrew. You may get some that still do, where it's like, but yeah, I think that's the best way to kind of like talk about how bioidentical hormones work. And it's amazing how well it works with your signs and symptoms. And the thing is as well, I mean, you can do a dose for a period of time, and then you can always adjust the dose. So let's say you prescribe it for 3 months, and then how are you feeling on it? Oh no, maybe I'm still getting hot flashes. You can always up a little bit of the bias. So it's kind of nice where you can kind of play around with the dosages and decide what would be the right dose for your patient.
Right. Yes, absolutely. And I agree. I don't see a lot of medical doctors prescribing like hormone therapy anymore. And I feel like they're maybe not necessarily confident in prescribing bioidentical hormones. So oftentimes we just get referrals, right? Because they know that we prescribe and track, and so it's very safe. And I guess the other part too, especially with the bioidenticals, is knowing that they are made in a compounding pharmacy in a sterile environment where the dosage is specific, right? So it's not just a tub of cream that you're walking out with out of the office and you're trying to figure out how much to put on, right? And so, you know, it's definitely a prescribed dose, measured dose. Yeah, definitely. So, and you know what, the benefits. So in terms of, and I know we spoke about, you know, the herbals and supplements where the benefits that women can get in terms of their symptoms, but would you say like the benefits are the same? Like you're getting, you know, a reduction in hot flashes and night sweats, and like what do you see with the bioidenticals?
Yes, I like when we talked about herbal, and sometimes it may not be as good, so or it can be, but then as soon as you add the bioidentical, I do find it's very quick. Like, I mean, it can take up to a month, but I find most of my patients within the first week or two, they're already noticing reduction in hot flashes, reduction in night sweats, their sleep is better. And because also adding that progesterone in there, they also notice like the weight loss, because a lot of women tend to have also a lot of abdominal weight gain in menopause. So they're also noticing that as well. Their mood is much more balanced, or anxiety decreases tremendously. If they also had depression as one of their symptoms, they find their depression is lifted as well. It does feel like the way they did when they were in their 30s or 20s. And I do have a lot of them come back and say, I feel fantastic. Like, this is amazing.
Yeah, absolutely. Wonderful. Well, it looks like we're coming up to the end of the webinar. I'm just going to look through here quickly to see if there's any questions. And I see one here from Suzette. She says, can you please provide the names of the supplements and herbals? So maybe can you just mention those, the herbal names again that you mentioned that you like to use?
Three, yeah. So chasteberry is one of them. The other one is black cohosh. And then my third one is ashwagandha.
Wonderful. Okay, well, thank you so much. We do have a bunch of information there in the chat in terms of if you would like to book an appointment, if you would like to follow us on social, please do. And we would just like to say thank you so much from Health Buddha. Thank you so much, Dr. Christina, for spending some of your time with us today. Please reach out if you do have further questions. Again, the information is there in the chat, but thank you so much, everyone, for joining us today. And again, thank you so much, Dr. Christina, for joining us. We really appreciate your expertise.
My pleasure. I hope a lot of people had a chance to get some information today and maybe even start applying some of these things, especially the diet and lifestyle component. Always start with that. And then if things are still not moving, then yes, definitely reach out to a naturopathic doctor, myself, Dr. Danielle, or anyone else in your area, because we can definitely help.
Perfect. Thank you. Everybody have a wonderful afternoon, and please join us again for upcoming webinars. Thanks.
Thank you. Bye-bye.